And joining me now with more about World AIDS Day is Christine Lubinski. She's Vice President for Global Health at the Infectious Disease Society of America. She's also the Director of Infectious Disease Center for Global Health Policy and Advocacy. Welcome to the program on this very important day.
Thank you very much for having me.
So December 1st was the first World AIDS Day in 1988. How has awareness and activism changed since then, in a nutshell?
Well, in 1988, everybody who got this disease was dying, and the government was doing little about it, and there was virtually no attention to the worldwide pandemic. So we've come a long way. We have life-saving treatment. We've saved millions of lives. We have good strategies to intervene and prevent people from getting the infection. And I think many people understand it a great deal more.
Is there actually a decline in AIDS-related deaths? And if not, what groups are we still seeing an increase in them?
Well, there's a dramatic decline in AIDS-related deaths. I believe over Southern and Eastern Africa, it's more than 30%. But infections are not declining among some groups, and not everyone has access to life-saving treatment. In particular, in Africa, young women are at greatest risk. About 50% of young women in some communities will be infected by the time they turn 24 years old.
Let's talk about Africa and South Africa, where it's predominantly high. What are the main obstacles here? I would assume education and birth control.
Certainly, family planning is a big issue, and using condoms, and many women are having sex with older men who may be infected. Now, South Africa has done a tremendous job. They've put millions of people on treatment and are now paying for most of their own response to the epidemic. But the sheer breadth of it, if you can imagine more than 6 million people living with the virus, is a huge undertaking.
How close are we to a vaccine, Christine?
Well, it's hard to know. I mean, Margaret Heckler said in the mid-'80s we'd have a vaccine in 2 years, but from what I understand from the scientific community, it'll be at least a decade before we have a vaccine widely available.
One of the biggest hurdles to overcome for aid workers is actually the stigma of AIDS. Tell us why this is still the case.
Well, I think two reasons. One, any infectious disease tends to be stigmatized. I think we've seen that so recently with Ebola. The other thing about HIV is it's a sexually transmitted disease, and it tends to affect people who are already stigmatized because of their race, because of their sexual orientation, perhaps because they use drugs, they engage in sex work. So there's an equation of the kind of things people do and the risk of infection, and I think that's really heightened the stigma for many communities.
Tell us about funding, not just in the United States, but worldwide to wipe out the disease.
Well, the United States is by far the biggest donor to the global effort, but unfortunately our investment has been declining in recent years, and there's a lot of worry that if you don't stay ahead of the infection, that in fact it could spiral out of control again. So many of us are really pushing so that we actually finish the job and we see an AIDS-free generation.
Christine Lubinski, thank you so much for the update and the education on such an important day. We appreciate your time and insight.